practice for us to look at a specific set of data regularly so we can see if there's actually changes in that, and try to reconcile what those changes actually might mean. And that's, at some point, that might actually mean that we change practice of some kind. And so we looked at some of that data in January, and was it January, last fall, and then we looked at some of it again in January. And then we have filled out this form that Lisa's bringing up. So this is what we're going to file with the state, and we want to make sure that this accurately reflects the things you all remember. So one of the data points we looked at was the number of children served, and we identified that there was nothing remarkable about either locality. It was consistent with historical numbers. While there's been some blips in the last couple of years, they haven't been big enough blips or sustained blips for us to pay attention to. And our planned response is to just continue to monitor that. Of course, we do that looking at those the child served counts every month when we look at the reports from the city and the county. And we look at the total gross net expenditures every month as well, but without looking at it in total, we hadn't noticed that in fact Albemarle's costs were significantly higher than both Charlottesville and the state, and that Charlottesville's costs were lower than the state. And so that was just something we noted the last time. We couldn't really identify why that might be in a big way, but we noted it. We thought maybe that was related to the number of kids who were in residential care for Albemarle for school. Is that an accurate reflection of our conversation? Someone nod. Okay, Jennifer's nodding. Thank you. Average gross expenditure by child, same kind of thing. We didn't notice anything beyond what we had noticed for total. Demographics, we noted that Charlottesville has significantly higher disproportionate number of Black kids served and significant higher number of males. And so this led to a discussion about the need to add diversity, particularly racial diversity, within the CPMT program, the CPMT program subcommittee and FAPT, and that we would identify that as one of the goals for working on in our work plan and identify some strategies for achieving that. We looked at child count and percent by service type, and we found nothing remarkable. We'll continue to monitor that. We had total gross expenditures by service type. Again, expenditures, actually not again, but expenditures in Albemarle, no, it is again, are likely higher because of the cost of private day placements, which is similar to our conclusions about the totals. Can you scroll up just a little bit? One more.
This where we are?
Yeah, I think we were on number 6.
Okay.
Well, no, we're beyond that. We're on 8 or 9. There we go. Perfect, thank you. So then we looked at CANs, and these are sort of not system outcomes or system metrics like the rest of them are. These are really outcome metrics, like how do kids perform in our services. And so we looked at CAN's child school domain. We noted that there was some concern around inter-rater reliability, which might affect the results. And so we want to pay attention to this, but we also want to make sure we understand how the numbers are derived and whether they accurately reflect people's experience in our systems. And the same with outcome community-based services. Actually, we have very high utilization of our community-based services in this region, and we will continue to monitor that. So we wanted to make sure before this gets submitted that this accurately reflects the incredibly robust, very nuanced and exciting conversation we had about these data points before we submit it, and that there isn't anything else we need to add.
Can I stop sharing now?
I believe so, because the silence was stupefying. I believe everyone there feels like this accurately reflects our conversation. Truth? Nod. Awesome. Thank you very much. See you back here next year for the same conversation.
Well, hopefully next year the costs will be lower for Albemarle.
Have you been driving the costs up? Next year with you gone, that's what's going to happen. The costs are going to be driven right back down.
Oh, yeah. It's all on me.
That's what I thought you were saying. I just wanted to clarify.
All right, is that a wrap? Okay. All right, so we'll move on to review of system functioning activities. Jennifer and Katie, are there any FAPT updates?
Nothing for the county. We're just continuing to plug along like we have been.
Yeah, I mean, I would second that for the city. I think we've noted some of our parent participation has gone down, I feel like, since a year ago or 9 months ago. So not sure what's going on with that. But we are also working on moving toward electronic signatures to help our process while we're all meeting virtually too. So we're working on that, but otherwise things are going pretty well.
All right, any questions on the routine foster care expenses or the FAPT approved expenses that you all received? All right. Jennifer, Katie, any updates, CSA coordinator updates?
We have a couple of updates. One update I have is just for the city. We did receive an application for a parent rep for CPMT. And that was supposed to go to city council, I think on Monday. So I'm just waiting for confirmation that that went through. And then I was going to reach out to the parent rep and kind of talk about the group and their role. So that's exciting. We haven't had a parent rep on this group for a few years. So more to come on that. The only other update Jennifer and I have is that we continue to monitor what's going on with Families First through DSS and the use of 4E funds. There was a webinar last week put on by DSS that I listened to that talked about congregate care placements and the changes coming with that. It sounds like there are still a lot of questions about what this is really going to look like. And I'm hoping we get some more information down from OCS in terms of how this is going to interact with CSA. So just more to come on that as we keep an eye out for it. And I think that was it. Jennifer, is there anything else?
No, I think that was it.
Okay. I think we're going to try to also have the contracts for next year come next month. It's contract time again. So we're working on that right now too. But I think that's it.
So Katie and Jennifer, and maybe even Sue and Mary, is there still talk at either the OCS or VDSS level about requiring some sort of a multidisciplinary team staffing to use the Families First funds?
They did mention that the other day. And one of the things that they said is they're really trying to use things that they already have in place. So that multidisciplinary team might be the FAPT. I know that also requires an assessment, and they said they're using the CANs for that. They talked about contracting, and they said they're not going to this was my understanding, they're not going to have like a separate contract to use 4E, that localities will just continue to do their normal contracting process. So it did come up, but it sounded like FAPT might serve that purpose. And I mean, these kids are already going to FAPT anyway. So that makes sense. And I don't think that'll be a big impact to our system.
Yeah, it's interesting because at the league level, there's been a lot of, hoopla about this and people really concerned. And I guess I end up scratching my head because I can't imagine that there'll be many times when the only funding being used is Families First.
Right. Well, and I think too, at least for Charlottesville, we don't have that many congregate care placements. Most of our DSS kids are in foster homes. So maybe other localities have higher congregate care numbers. I don't know. And I haven't heard as much about what's going on with the prevention side of Families First or Family First. So I'm interested to hear more about that.
There's talk about requiring some kind of a MDT process for the prevention monies. And there's concern about the burden on FAP, but I guess my question is, I can't imagine that a family will only be receiving a service funded by the Families First, but rather it would be a blend.
Yeah, I mean, I think there's other localities that definitely look at Medicaid, like their prevention cases might be Medicaid only cases, so they're not having to come to FAPT, that probably don't fund as much through prevention as we do, maybe don't have as many prevention cases as we do. But for us, you know, I don't think the impact is going to be huge. I think I'm more concerned about, you know, how, like, are we going to need to justify why a QRTP wasn't available or something like that before we can use CSA, or justify why we didn't pick it, why an evidence-based practice wasn't chosen before we used CSA or something like that, like kind of like what we have to do with Medicaid right now. But it sounds like there's policy coming out from DSS in June. So we'll see.
I have communicated with my budget folks, though, that I'm very concerned about the impact on CSA, that we will no longer be able to use 4E for the daily supervision and room and board for both therapeutic foster care and congregate care. I worry that that's going to have a significant impact on the CSA expenditures.
Sure.
So again, I've communicated that to our budget folks to give them a heads up. Anything else on that? All right, OCS communications, Jennifer, Katie.
So the 2102 was for the gap survey, which I guess program should have that ready and out to you all for the April meeting. So we'll be bringing that then. 03 was about the automation of the SPED RAP allocation process. And so if you're requesting those additional funds, they've changed how you go about requesting it. And then 04, which doesn't really affect a whole lot of people. It's the leaders file layout changes. It's so it's your finance folks who know that those changes affect them. So that's really what that memo was about. So that was the 3 that came out.
Any questions on any of those memos? I know the county submitted a request for additional SPED RAP funds. In fact, I just did it this morning. So, well, actually, now I think it's in the fiscal agent's inbox, but it's not. So hopefully that'll go through. All right, Krista, program committee update.
We don't really have an update. We weren't able to meet this month, but we are continuing to finalize the survey with the suggestions that CPMT put forth last month. So hopefully we'll have that ready for you next month, and we'll be working on the gap survey.
Great.
And that's
Thanks.
it.
Any questions for Krista? Okay, I don't think we had planned to review the work plan, right, Jennifer, Kate? Okay. So the next item was the mandated versus non-mandated money discussion. And if you recall, last month I had raised the question about the fact that very little of the Albemarle dollars are being spent. And so what I remember, if I remember correctly, Martha, were you going to kind of reach out to your fellow directors in other jurisdictions to see if that a similar trend is happening? Am I remembering that correctly?
I can do that. Yeah, that may be an oversight on my part, but I'm happy to do that and see if that's happening in other locations too.
I mean, it might be useful just to know if Albemarle is an anomaly.
Right.
Or whether
Right.
if there's kind of a trend, then maybe we as a group can have more conversations about, should we think about a different kind of plan or so.
Yeah, I feel like in the city, I mean, I don't have the numbers, but I do feel like we don't use as many non-mandated funds as we used to. I could certainly get those for the next meeting as well. And I don't know if it has to do with, the rollout of FFT and MST, and this court service unit, using those because there was other funding for those, or if it just has to do with the cases or what's going on or not. But I definitely know we've seen that in the city too.
If I remember correctly, what you shared with me, Martha, was it is a combination of numbers of cases going down and also having other funding for these specific services, right?
Right. Having the continuum of care funds has made a big difference, but caseloads are significantly lower. We continue to watch that monthly. I'll reach out to my colleagues through our association. I also say, I mean, Charlottesville and Albemarle have been an anomaly in a good way, in that, we really were able to make use of non-mandated funds historically and served a lot of kids. And there were a number of jurisdictions that didn't have that practice. So, but I'll let you know next month what I hear from my colleagues.
Great. I just don't want us to send money back to the state.
Yeah, and I was curious how other jurisdictions are using it, but I get the impression that a lot of them don't.
Yeah, there certainly are some that don't, and there's some that have, very small pots of money. Some rural jurisdictions that we have in the district that wouldn't be enough for a congregate care placement. But typically in Charlottesville, let's see, Culpeper and Goochland are the two that don't use non-mandated funds. And again, the others are smaller pots, and they've been used primarily for, outpatient services.
All right, well, we'll put this back on the agenda for next month. How's that sound?
Okay.
Okay.
Sounds good, Phyllis. Thank you.
Mm-hmm. So the planning team, meaning Kaki, me, and Katie and Jennifer, raised the issue of, historically we've often had a retreat sometime in May, like a half-day retreat, or sometimes we've had it all day. And we wanted to get a sense from the group about what the interest would be in terms of having another retreat. And, I think we primarily have focused on the work plan and talking about kind of where things are and what other goals we want to add. And if there's interest in having a retreat, then the second question is whether the desire would be to have that virtually or in person. So I'll just open it up to see what thoughts folks have about, first of all, just having a retreat at all. And Kaki says, with cookies and fruit and positive collegiality. I don't know how to pronounce that. And you're going to bake the cookies. Okay, good. So thoughts on a retreat? Don't all speak at once.
Yes, please.
Because you want to make cookies.
I would like to eat cookies, so I'm in.
I've never been to the retreat before, but it sounds like it might be very beneficial.
Again, I think historically.
Yeah, I would certainly.
Go ahead.
No, I think, typically it's been a good process, and I would certainly be on board. And I think too, we're in a situation where we've said farewell to Diane. You'll be leaving us. We have new folks coming on. This is somehow a way to kind of facilitate some of the process we go through as a group with those changes. That might be good too.
Thanks, Martha. I agree with that. I would appreciate that opportunity.
So I think there have been times when we've actually just taken our regular meeting and extended it and had the afternoon. How do folks feel about doing that in May? So that would be May 19th. So I think we've typically done having lunch and then having the rest of the afternoon for the retreat. Would that work for your schedules? Like a 12 to 5 kind of thing? What do you all think about in person versus virtual?
I think a lot of that depends on how many of us have received the vaccines. So,
Yeah,
I mean,
and the other possibility is, could we do something outside too? I think that might be something to consider. So maybe we kind of think about it and look at it again in April.
Martha, are you suggesting we do kickball?
She said,
No, I like kickball, but but no, that would be fine, Jackie. And I
She
wouldn't
did-
bake cookies, but I could buy some if you don't want to bake them all.
I think
she did
that's
say that she
okay.
wanted relationship building. So outdoor field games is more of what I was thinking as well. Ropes course, all of it.
100%.
You're making me tired already.
I might be busy that day. No.
Just starting to sound like the old days.
Yeah. All right. Well, why don't we, for this point, say we'll definitely put that on our calendars. We'll revisit in April, outdoors, in person, stick with virtual. And in the meantime, the planning team will have a preliminary discussion about some thoughts on what we can work on and bring that back in April. How does that sound? So Kathy, Katie, and Jennifer, don't help me remember that we should talk about that in our next planning meeting. All right, but in the meantime, put that on the calendar, May 19th from 12 to 5-ish. All right, awesome. Okay, does anyone have any update from their respective agency? Sue, how are you holding up? All right. Any updates from Region 10, Court Service Unit, schools, human services?
We had a bunch of kids come back this week, and it's been really wonderful. In some schools, more kids than we had thought that just decided or messed up their day, but it's all gone really smoothly, and it's great to see kids back in school. It
That's
really
awesome.
is. It's
Right.
neat. Yeah, it's been a long time coming.
Mm-hmm. So Kendra, I read in the paper that your superintendent is retiring.
Yes, she is, after 15 years.
I was just going to share at community attention, one of our program supervisors at CAF, Julia Rubarth, her last day is today. She's moving on to take a position at the state. And so I just want to make sure everybody was aware.
Oh.
Can you say that again?
One of our program supervisors at CAF, Julia Rubarth, today is her last day, and she's moving on. She's taken a position with the state to work on policy. So we'll still stay connected, and we'll have a relationship with someone that works on policy, which is really promising.
Will she be working with Garrett?
Correct. Mm-hmm.
Well, we'll blame Garrett for stealing it. All right, any other updates?
We did our Georgetown kickoff last week. It went really well. We have our second session scheduled for March 30th. If I'm wrong about that, Krista, correct me. And beginning to have some discussions kind of about the fact that Charlottesville, we're part of a Charlottesville Albemarle community, and how to look at that and think about it a little differently, because the original project had been just Charlottesville focused. So we're moving along.
Great. All right, any other business from any of our awesome CPMT members? Well then, you have an extra hours in your day. use it wisely. Go have a cookie. And seriously, have a great day and thanks everyone. We'll see you next month. Bye.
Thanks, everybody. Bye.